Okay. Perfect. Well, thank you all so much for joining us today. This is week 3 of the Digital Opportunity Champions program. So excited. It's going by really quick. But the topic for today is what is telehealth? So it's really just an introduction to some basic concepts of telehealth as we get into more details on the further weeks. So super excited. We're going to go ahead and jump right in. So just to define some objectives before we get going, of course, the main objective is defining telehealth and other key terms that you'll need to know. We'll also provide a step-by-step walkthrough of what a telehealth visit looks like. And finally, we will discuss the benefits and the challenges of providing telehealth services. So, what is telehealth? How are we going to define telehealth? So, telehealth refers to the use of digital information and communication technologies to provide and support healthcare when distance separates patients and providers. This includes video consultations, remote patient monitoring, mobile health apps, as well as secure messaging. So here we have two more terms that will be really important for you to know, which is the originating site and the distance site. So the originating site is the location where the patient is situated during a telehealth visit. So of course, this can include many different locations depending on the patient, including their home, a medical office, or a community clinic. This would also include telehealth hubs. There are certain locations, such as libraries, where they now have telehealth hubs where patients can come in. They have a private, secured room. Sometimes they have a digital navigator who's kind of able to help them get connected and set up for that telehealth visit. The distance site is the location of the healthcare provider. So that's the clinic that they work at, or obviously the hospital. Again, I think these are important terminologies that it's important to be familiar with as we're going to go into more detail about telehealth. Okay, so more terms. So there are two main types of telehealth. There's synchronous telehealth and asynchronous telehealth. So synchronous telehealth is probably the thing that you think of when someone says the word telehealth, right? It's that real-time interactive communication between the patient and provider. So the example is live video calls where you've got, the patient's on a video call, provider has video on, and you have that audio visual between the patient and the provider. Synchronous telehealth can also include just phone calls. So even if there's no video available, if the patient and provider are on the phone and they're able to speak to each other in real time, that would count as synchronous telehealth. Asynchronous telehealth, on the other hand, is what we call store and forward communication, where the patient data, so whatever that may be, images, lab results, etc., is sent to a provider for a review, and the provider is reviewing it at a different time. So maybe the patient wakes up in the morning, they're like, hey, I noticed this weird thing on my leg, here's a picture. And then later in the day, when the provider has some time, they are looking in, logging into the EHR, their electronic health record, and they're taking a look at that picture and giving a response to the patient. Asynchronous telehealth also includes remote patient monitoring, which we're going to get into in a second. But I think the most accessible example of asynchronous telehealth is a patient portal. So a patient portal where the patient can log in and they can send messages or questions or prescription refills to the provider, and the provider can respond to those requests whenever they have time during the day. So when you think of synchronous telehealth, again, you're most likely normally going to think of those live video calls. And then when you think of asynchronous telehealth, again, I think that patient portal is the easiest example to think about. You have, each patient and provider communicating with each other based on when their schedule allows them to do so. So remote patient monitoring, getting into that. Again, that is a form of asynchronous telehealth. And we're going to define that as the use of connected devices to collect health data, so glucose monitoring, blood pressure readings, and sending it to the healthcare providers. So specifically, this involves specific devices. So for example, for the glucose monitoring, you may have a continuous glucose monitor. So that can be like a patch that the patient wears on their arm that automatically collects their blood sugar levels at certain points throughout the day, and maybe it's sending those readings directly to their healthcare provider. There are also now blood pressure machines that are not just your regular blood pressure machine. They have, that remote patient monitoring capacity where at throughout the day, whenever the patient is taking their blood pressure at home, it's sending that reading automatically to their doctor so that they can have that data logged and collected. So now that we've gone ahead and defined some of our basic terms, what we'd like to do is really walk you through what does a telehealth visit look like from start to finish on the patient's end, really. So let's jump right in. So to start with, of course, you would schedule that telehealth appointment, right? So patients and office staff would work together to book an appointment. This can be through an online portal. So again, oftentimes patient portals do have this option where you can go in and schedule an appointment and you can select whether you'd want that to be in person or a telehealth appointment. But of course, this can also be done the traditional way over the phone. You can call the office and they can set up a time for that appointment. Next would be, appointment information and reminders. So prior to the appointment, the patient should receive a reminder either via text message or email. The patient should also receive a link to access and log into the appointment. So again, a lot of the times the patient portals are set up to do this automatically. So if you set up a telehealth visit, typically, nowadays you get regular appointment reminders for in-person visits as well, but you would also get that for a telehealth visit. But they should get an email or text message again automatically from the portal with that link to access the appointment and to log in to the portal. Oftentimes, the patient portal is also where the telehealth visit will take place. So there's not a separate telehealth and like a video conferencing software. The patient will log into the patient portal, and that's where the video conferencing screen will come up for them, which I think is really convenient. So prior to the appointment, you would want to do a technical check. So I think ideally this would be done, both on the patient side and the provider side. So you want to ensure that you have a stable internet connection, a working camera and microphone, as well as access to whatever telehealth platform that your provider is going to be using. There's also sometimes pre-visit paperwork. So there may be, health questionnaires or consent forms that patients need to complete. Ideally, the healthcare provider would communicate these requests to the patient, again, via email or a message to the patient portal ahead of the appointment. Oftentimes, again, the portal will have a place where you can go and electronically sign paperwork as well, which is, again, is convenient for patients, I think. So when it comes to the actual appointment, these are the steps that we typically advise for a patient to do. So a few minutes before your scheduled appointment time, you'd want to log on to the telehealth portal and make sure you can access it. Your audio again and video are working. At the start of the appointment, there may be a nurse or a medical assistant that comes on first prior to the healthcare provider. So sometimes it's really important, if you're a digital navigator or someone that's just helping a patient navigate telehealth visits, to let them know that prior to seeing your doctor, you may see a nurse or a medical assistant, just like you would if you went in for an in person visit. They may collect information such as, what's your complaint today? What brings you in? They may ask you if you have a blood pressure machine at home to take your blood pressure or blood sugar, depending on, what your health conditions are. And they may also do some surveys or questionnaires as well that they need to collect. Oftentimes, patients will disconnect if they see someone other than their doctor hop on because they're a little bit doubtful or hesitant about telehealth. That may be kind of a shock to them. So informing them ahead of time, there may be this nurse or medical assistant or other medical provider that you'll see first, I think can help a lot. After that, obviously, when the physician comes in or the healthcare provider comes in and conduct the appointment, it will mirror the structure of an in-person visit. So again, I think that's really important when we're talking about, generating patient buy-in into telehealth. Oftentimes their hesitation is, oh, is it going to be the same as my in-person visit? Am I going to get the same quality of care? So I think it can be reassuring for them to hear that it's going to be the same as your in-person visit. The doctor's going to hop on, they're going to say, hey, how are you doing? What brings you in today? Are there any changes in your health? Talk to me about your medications. Is everything going okay with that? It will really proceed just like an in-person visit, and you will get the same quality of care. You're just getting it virtually as opposed to getting it in person. So again, follow-up care. So after the telehealth visit is over, one things that you need to keep in mind are scheduling of future visits. Oftentimes you will need to again call in or go into that patient portal to schedule a future visit based on whatever visit cadence the healthcare provider wants you to have. Medication adjustments, if your provider adjusts some of your medications, you want to be aware of that, or if they sent in a new prescription to pick up, you want to keep track of that as well. Lab or imaging orders, of course. Oftentimes, again, the provider can put this in, and you'll be able to view it in their patient portal. Again, referrals as well. It's the same thing where providers will coordinate that referral and they may be able to put it into the patient portal for you to review. But again, when you're in the clinic as a patient, right? I think some of this happens automatically. So you walk out of the exam room, right? And you walk up to the front desk and they schedule your next visit. Or your provider hands you a set of papers that, detail out your medication adjustments and things like that. Some of that, of course, when you're doing a telehealth visit, it doesn't happen automatically. So these are just factors we think are important for patients to keep in mind when you have a telehealth visit, that these are the factors that, again, you'll need to kind of keep track of as opposed to, it would happen automatically kind of when you go into the clinic. So I'd say that's probably the most major difference between an in-person visit and a telehealth visit is patients do need to be a little, cognizant of the fact that some of these factors they need to take care of, they need to keep track of. But again, you have your patient portal most of the time. If they're doing telehealth, they will have that patient portal that will help you kind of keep track of these things as well. And of course, you can always call the clinic if you have questions and message your provider for any additional details that you might need. So I've talked a lot for the past, a couple of slides. So we wanted to throw in, just a quick discussion question here. Um, the real goal that we have throughout these workshops is really to get you all thinking about where do you fit in, right? Whatever organization you may be working with, whatever your role might be within that organization, um, how do you think you can help or fit into a flow of a telehealth appointment? Some of your programs may not have telehealth offerings right now or digital navigators or things like that. So if that's the case, really, we're encouraging you all to think about what kind of new initiatives or programs might your organization be interested in setting up that relate to, of course, telehealth or digital health technologies. So what are some thoughts here based off of what we've just kind of talked about? Yes, Turkisha, is that how you pronounce your name? Turkisha?
Yes.
Yes. Perfect.
So one of the things that I found is that we work primarily with older adults, and they get the appointment notifications, but they never actually go into the portal. So
Mhm.
one, like I am doing a training this week, maybe next week, I can't remember, about this. They're like, oh yeah, I get the notifications that they complain about the number of notifications they get about the appointment.
Mm.
But I'm like, so that there's a portal where you can read your results and actually start asking questions of the doctor so you're more prepared for your visits. Some of them do and some of them don't. So the people that are already in the portal, they're gonna be my co-teachers and kind of walk people through setting it up. But that's
Yeah.
what I found. They get the notifications, but they don't actually go into the portal. Like my mom was the same way.
Mm.
I'm like, well, just let me manage my chart. So now she's calling me saying, what's my next appointment? And that, which is fine, because at least
Right.
somebody is looking at the information and can ask questions when she goes to the doctor. But I think preparing them better for appointments, whether virtual or not, is the key. Like getting them to actually go into beyond, oh, you have an appointment on Thursday. Well, what is the appointment for? Which doctor is it? Especially if you're across multiple systems. Because
Mhm.
in Greensboro, we have about 6 different medical systems here that people are navigating. So, Those just my thoughts.
Yeah, I think you make a really great point about, again, walking the patient through what the visit is going to look like, whether in person or telehealth before the visit, right? And I also really like the fact that you mentioned, you're going to do trainings, but the people that are already well versed in that can kind of do this peer-to-peer support, right? Where they may more closely understand what confusion or what difficulties or issues that their peers are running into when they're trying to set up these visits or access their patient portal. So I think that's a really, really great idea that you just mentioned there for sure.
Yeah, one of my people is like 80 years old, and she's like, "Oh, I use my chart, so I can't wait to see her explain to other people what they can see."
Yeah, absolutely. And I actually worked, so prior to working at the Office of Rural Health, and I'm just now realizing I did not introduce myself for those of you who aren't familiar with me. My name is Mary Sampath. I work with the Office of Rural Health on the Health Information Technology and Telehealth team. I started working at the Office of Rural Health in December 2023, but prior to that, I worked at a primary care clinic actually for about 2 years. And it was more geriatric care, so Medicare, Medicaid patients. So I've seen this firsthand, right? A lot of those patients need telehealth the most because they have a chronic illness, they have a condition that, prevents them from being able to come into the clinic, or they have transportation issues or whatnot. But again, they have the hesitation. And a lot of times it's just because no one's ever explained it to them. Right. And even if they have explained it to them, they haven't gotten down on their level and explained it to them. Right. Like the providers explained it from their level of understanding. And so I totally get what you mean. And I think that's such a brilliant idea, again, of having their peers explain it to them, because I think when you are in that group of peers, again, you have an understanding of what issues or concept gaps there may be, so you can, I think, more effectively address that than someone, again, who's coming from a different level of understanding, right? Because it's their job or they work with that on a daily basis. Yeah. Other thoughts about this?
I was gonna say that I do like digital skills class with my work, and so I found I like pull up my chart and walk them through the patient portal,
Mhm.
and I'm like, oh, these are the lab results that you can look at before the doctor calls you. And like today when we were looking at it this morning with the group, it's like now it'll show you your actual x-rays just instead of what the doctors read about them. So I think physically walking them through and showing these are all the options available, it makes them more um they seem more open to using it in the future. And then I also like to show, because I'm with ECU Health, so ours is an Epic My chart, but it also has videos in there that if people are confused, they can watch those, and it kind of helps walk you through whatever you're trying to do as well.
Gotcha. Yeah. Janelle, were you gonna say something? I think you unmuted yourself.
Yeah, I was just gonna say quickly, I just, kind of was interested in this seminar because we are providing digital skilling services at the Goodwill now. So we're
Okay.
just kind of toying with the idea of providing digital navigating services and what does that mean? And so just been trying to think through what other additional services I can offer residents in in-person setting. And so I
Mhm.
thought telehealth would be great because it's something that I utilize. But it's definitely something that a lot of people are not familiar with, especially if they're not using the computer on a daily basis. So I think that this is great value add, and I think it'd be good for seniors and for others. I think there's a lot of people that don't really know this is a resource for them to utilize, and they're kind of used to that calling the doctor's office for everything they want and need, and it,
Mhm.
don't really have that realization that it'd be probably a little more easier and convenient for you to kind of use to be more familiarized with that portal.
Yeah, absolutely. And I will say, my colleague Courtney and I, this is kind of what we've been working on for the past year and a half about. We designed, this digital skills curriculum as a part of our work. And when we were designing that curriculum, we also designed a health language curriculum as well. So kind of digital skills and some basic healthcare concepts that you might need to know, especially for those living in rural areas, who may not have access to healthcare. But when we were building that out, we built a section about patient portals and telehealth and things like that. And it was complicated, I think, sometimes to teach about patient portals because there are so many systems. Turkisha, like you were saying, sometimes there's like 6 or 7 different health systems, and they have their own EHRs or EMRs and a different portal that connects to it, and they look a little different. And so one thing that we did when we were kind of designing our patient education is to, again, focus on the functionality of the portal rather than the actual portal itself, because we wanted to make it, generalizable. We wanted like anyone across the state to be able to use this curriculum. So again, we focused on what are the functions of a patient portal? What can you do inside of that, right? So you can put in a prescription refill, you can message your provider, you can look at your lab results, things that are common even across different providers or different healthcare systems or different EHRs. So yes, Sydney, to your point, I think that's really important as well. But yeah, these are all great suggestions. And Janelle, I think that's an incredible program that you just described, providing digital skills out of the Goodwill, which oftentimes can be, a pretty central kind of community-based location, right, to reach people, for sure. So that sounds incredible. And I definitely think if you can make the telehealth work, that would be an incredible offering, again, in one of these community local locations where you already maybe have people coming in and out of there, right? So kind of easy to reach the public for sure. These are all such great points. Anything else to kind of add in? Okie doke. So now we'll kind of go in again to talking about the benefits of telehealth. So based off of kind of what we've just discussed, and you guys have already kind of touched on this, but what benefits are there for the use of telehealth, do you think?
Well, I think one is that it gets people more in tune with actually what's happening with them. And if used correctly or more frequently, it helps them prepare. Because I will say culturally, Black people, we do not enjoy the doctor. And that's just historically and systemically some things that have just transpired. We don't trust the medical system.
Yes.
And I think that by using telehealth, we can see exactly what's happening. Like we don't have to wait for the doctor to tell us, although we should, because then we start Googling. Maybe that's just me. But we can see the numbers. We don't just believe the doctor telling us, oh, your A1C is 8. It says it on the paper. So I think that it gives us a little more, just culturally, a little more truth on the line to say, okay, I can really believe what you're saying now because these are the tests instead of just hearing it. Because especially for older people, we just believe everything the doctor says. And sometimes we need to get a second opinion or those kinds of things, regardless of what ethnicity or race you are. So I think it gives them some skin in the game to say, well, the paper said this. So explain to me how what you're telling me matches with what the paper said or the test says. That's been the case for my mom. Like we can really use it to ask questions for continued care and not just for that appointment.
Yeah, absolutely. I think that framing is so important of like, this is something that can help you, the patient feel empowered to take charge of their own health, right? These are tools that can be really helpful for you, which were not available in the past. So as you say, you just had to rely entirely on the healthcare provider and their paper records, basically. And you have access to your medical record, but the fact that it's on paper, there's so much more of a lengthier process to actually get into those records, as opposed to now you just log in, type in your username and password, and there's your whole medical record, right? So yeah, for sure. I think that framing is so, so important. Other thoughts?
I think another benefit is, and I'm not sure how this works with other types or brands, I guess, of the patient portals, but with the Epic patient portal, you can allow others to like get and have access to your stuff. So if people are helping you manage your healthcare visits and just manage everything going on, it's a great way that they can see what's going on with you. So it's just a lot easier for them. And then that can just make care and everything else a lot more cohesive.
Yeah, absolutely. And I think most of the Epic based EHRs and then some of the smaller ones maybe don't have feature. But yeah, for caregivers and other people, involved in caring for others, I think it can be really, really, really helpful to just, again, not have to go through again the office or things like that. You have it in the palm of your hand, right? In your smartphone or your laptop or device. To be able to keep track of your, if your family member lives in a different city, right? Maybe that you don't live close enough to them. But again, you want to monitor whether they're going to their visits and how their health is doing. Again, it provides that level of convenience, I think, that wasn't available before. So yeah, definitely.
Absolutely. And I'm going to hush after this. Mira, is that how you say it? I want to
You're
make sure I'm
good.
saying it
Please,
right.
please go ahead. Go ahead.
So I agree with Sydney because I'm 3.5 hours away from my mom. So it's easy for me. Like once I see the test results, I can plan. Okay, the next doctor's appointment. I let my siblings know. Okay, these are the things we need to ask. Blah blah blah. But also, my mom travels with me pretty frequently. So
Mm,
if something happens, I can go into the portal and have them find me a physician where we are. That has been really
okay.
helpful when
Yeah.
she's traveling with me, just so people know, and I can give them access to her records without waiting on the doctor and that kind of thing.
Yeah, absolutely. I didn't even think about that, but that's actually a really great point. When you're traveling and you're in a different system, hospitals, you're in a different state altogether, they have a completely different system. To request records, oftentimes across systems like that is really complicated. But if you can just log into the patient portal, be like, here's my phone, here's all their records, right? And that can be such a vital piece, especially if you're in like an emergency situation, not having to wait on those records getting faxed over or something like that, trying to get in touch with your primary care physician. Yeah, it's just incredible. Again, I think the framing here is like these are empowering tools, right? If you know how to use them, these can really, really just be so impactful on your health outcomes for sure.
I was just gonna say, I think it's definitely a benefit because we definitely want to set the residents up for the future, and
Mm,
health is definitely going in this framework where it's going to be less and less for you able to actually speak to a human on the phone, and so
mm,
showing them these tools now and getting them used to being able to utilize them, being comfortable and experiencing that access and the benefit of it, can only, help them, to continue into the future in order to be an active participant in their, medical care. A lot of people were speaking about the ease of accessing documents online. I think it's really great because, whenever you go somewhere, they're always like, okay, what medications are you taking? And most medications have these long names. And so, it's great for you to have that accurate, okay, this is the exact name, this is the doses I'm taking, the times a day, and for you to really be able to advocate for yourself, instead of saying, I don't know, I don't know, I don't know, you can
mm.
actually say, no, I do know, and actually here's the information right here in my hand.
Yeah, absolutely. And I can testify to that myself. So I helped caregiver for my, grandfather in the last couple years of his life. And he had a decent amount of health conditions. And I remember we had this like plastic box with all of his medications in there because he had so many medications he had to take. And we just lugged that around from visit to visit. Just so any doctor we go to, because he had a lot of specialists, needed to know all the medications he was on. And then later on, it became so much easier with the patient portal. Just log in and here's the medication list, right? Oh, what did the cardiologist say at the last visit? Here it is. Here's their note. You can go ahead and read it, right? So again, especially for those who may have chronic conditions, several different health conditions, I think having quick, easy access to that information can be so, so vital. So yeah, absolutely. This is these are great, great discussion. Um, Again, we just had these three main ones. You guys mentioned so many other ones, but I'll just go through these real quick. So of course, increased access to care, the main benefit. Telehealth visits and remote patient monitoring are again all modalities that can be used in conjunction with in-person visits. So it thereby you expand the number of options that patients have, right, to access care. Convenience, of course, if a patient is facing barriers such as transportation, busy work schedules, or their caregiver themselves or someone else, right? A telehealth visit really provides that flexibility and it can potentially mitigate those barriers that you might be facing. Additionally, for patients who need regular monitoring, so blood pressure, blood sugar, remote patient monitoring allows their healthcare provider to collect and track that important data with ease without inconveniencing the patient, right? The patient's able to just, take their blood pressure or monitor their blood sugar in the comfort of their own home, and the physician is able to track those important values, again, without inconveniencing the patient. And continuity of care. So telehealth visits can be used to maintain continuity of care for individuals that may have chronic illness or disabilities or any other health concern really that doesn't allow them to come into the clinic regularly for in-person visits. So when I worked at the primary care clinic, often older people fall and they break a bone, or they have heart failure and they have a lot of swelling in their legs. Or if they have a caregiver that maybe doesn't, their schedule doesn't allow for them to bring in that person that day. Again, you maintain that continuity of care. The physician is still able to get the data, the health data that they need from their patient. And I will say continuity of care becomes so much more important, again, for chronic illness or disability or any other long-term health concern. It's really, really important for your healthcare provider to be able to keep in regular touch with you. And again, make sure that your health is, that you're well and that there's nothing, going on that needs to be taken care of. So these are kind of the three that we noted, but you all mentioned so many more in the discussion. So I definitely think, the benefits of telehealth cannot be understated. If used well and in the correct way, and people are trained on how to use it, I definitely think the benefits are immense. So that brings us to barriers, right? So we've talked about this a little bit, but I would like to throw it out to the group. What barriers do you see for the use of telehealth? What are things that, can prevent people from being able to use the technology to its full potential?
Well, I think basic tech skills sometimes. Like we started with in this particular class I'm working with at the senior center, we started with how do you use your phone? And we haven't necessarily talked about apps, but like sometimes telehealth comes up in your internet browser. So what does that look like?
Yep.
And the differences between it. So I think that's what we're going to talk about next week, like the differences between here's what it looks like on my phone and here's what it looks like on the computer, so they'll know that they didn't do anything wrong, because they are so afraid to mess something up that they just stop.
Yeah, absolutely. That can be digital skills or digital literacy can be a really, really big barrier because again, all telehealth requires the use of some kind of device. And so you have to know how to operate that device in order to access care via telehealth. So yeah, definitely.
I was
Other
gonna
thing?
say, just general fear. I
Hmm.
think that it's hard to relearn something or to learn something or to move away from what you're familiar with. And even if they may use apps or be a little tech savvy, there might be that apprehension of, accessing personal documents on the computer
Hmm.
or online, or to Terkeisha's point, am I going to mess this up if I press this button? Would I be able to access the next time? And so just getting over that fear that it's okay, you can make a mistake, that it's not like a boogeyman, I think
Right.
that's a huge barrier to people even kind of even getting started on the cello. Because I think once they get in it, they kind of like, oh well, this is not that bad. I can kind of play around and maneuver, and it's nothing is going to fall apart.
Hmm. Yeah, absolutely. You touched on so many important things there. Um, Definitely, I think a lot of the educational material sometimes, again, doesn't really come down to the level of understanding where people are at, right? It's not meeting you where they're at. I say all the time, like, we're in the smartphone age now. We have more access to online resources than ever before, but that doesn't mean that all of the resources that exist are actually accessible to the people that need them, right? It may not be written at your reading level. It may be assuming you have certain skills, right? Or making an assumption that, oh, you have this knowledge and now I'll build off of that. When the reality is, a lot of people, especially in rural areas, they may have never seen this technology before. They may have never had a smartphone at all. They may have a flip phone, right? They may have never had a laptop computer or a tablet or any device. So meeting people where they're at, I think, is really important in that understanding. And then you mentioned, the privacy concerns as well. We heard this a lot we were trying to build out our curriculum last year. We did some grassroots work. We kind of talk to folks who live in rural areas and work with patients, and they mention that a lot, especially in the older population. They're really worried that they're going to get scammed, their information is going to get stolen somehow. And I saw this at the clinic too. I remember there was a patient that we did a telehealth visit with because he had just been discharged from the hospital. And I remember he was like, oh, I don't, a lot of patients they were like, I'm worried. How do I know I'm speaking to my doctor right now? I can't see you. I can only hear you. So there is a lot of, I think, distrust, which is valid, I think, because they've had experiences, right, that have generated that distrust. But I think that the question then becomes, how do we, create that sense of comfort, right? And I think you're right. I think the education piece of it is huge and really walking people through, what the safety and how safe it really is, the encryption and all of that. For sure. Yeah. Other thoughts for barriers? Well, these are the main four ones that we kind of came up with. Again, you all have mentioned other ones, but technology, of course, we just talked about this. Telehealth does require the use of devices, whether that be computers or smartphones, or even routers or hotspots to get internet access, right? I think when we think about digital skills, we think about computers, smartphones, tablets, but you also have to know how to connect to the internet. So whether you're using a router, a hotspot, a Wi-Fi, that might look different, right? So I think that can also be, again, a device where you need digital skills. But a lack of digital skills, again, can be a significant barrier and cause hesitation to use telehealth for sure. Reimbursement, this is more again on the healthcare provider side, but I think this is what causes hesitation for healthcare providers to offer telehealth in the first place. So policies and guidelines around telehealth keep changing, and there are many factors involved in order for a healthcare provider to get a reimbursement for a telehealth visit. So for example, oftentimes there's a certain amount of time you have to spend with the patient, right, in order to get reimbursement for that visit. There are very, very specific visit or CPT codes that you have to use, and those codes have to be proper. And if they're wrong, that can delay or get your claim denied for reimbursement for that visit. So I think a lot of healthcare providers, for them, because the landscape of the policies keep changing, what's allowed to get reimbursed and not when it comes to telehealth keeps changing, I think it causes a significant amount of hesitation for them to want to offer telehealth, right? They're like, it's too complicated. We're just not going to offer it at all. Let people do in-person visits. Privacy, of course. Patients can do a telehealth visit from anywhere, right? Whether they're in their home or they're at work. But either way, they may not have a private place where they can do that telehealth appointment. Even within your home, like you may not want other family members necessarily hearing all of your private health information, right? So again, I think that causes hesitation for patients to even schedule a visit like this if they feel like they don't have a place where they can go to conduct the visit. And then, of course, internet and broadband connectivity. So for those of you that were present for week 2, that was kind of the topic that we talked about last week. But just to kind of recap it, of course, if a patient doesn't have internet, they can't access telehealth, whether that be synchronous or asynchronous, right? But even if they have internet, I just want to emphasize that the internet needs to have enough bandwidth to support a telehealth visit. So especially if you're doing that like video call visit, that does require high-speed internet connection. So patients might have internet, but it might not have enough bandwidth in order to actually support like an audio visual telehealth visit. So that's really important to consider as well. So there are significant barriers that we do have to think about. How can we help patients and healthcare providers mitigate those barriers in order to conduct telehealth visits for sure? So we had planned for, breakout groups, but I think we had a decent amount of discussion questions already during this session. So, and we're a pretty small group already, so I feel like it was already kind of a breakaway group kind of experience. So I'll just open it out to the group. What are your kind of thoughts, takeaways that from this session? And what are you kind of thinking about, as we come to the close?
And so many more people need this like
Yeah.
to just understand why telehealth is important and why we
Yes.
have to spread the knowledge out with the people we work with.
Yeah, absolutely. And that's really our goal, I will say. We developed these trainings and we wanted to do again a cohort to kind of just see, is there interest in this? Is this, important information? Is this filling a need? And so far, I would say the general response seems to be yes, there is a need for this. So thank you for sharing that feedback. It's always really helpful for us to hear that. And we're definitely looking into more avenues to kind of, help this reach a wider audience for sure. Other thoughts just about telehealth in general. Again, as we move through the weeks, we're going to go into a lot more detail about these concepts, but we did just want to provide this really like an introductory lesson to set the stage for what's to come. Other thoughts, questions, anything?
I was just gonna piggyback off what Takesha said. I definitely think it's important and not a topic that's talked about, I think, enough. I definitely see a lot of like lawmakers wanting to move away from telehealth and supporting
Mhm.
that. And I think that they knew more about it, more of the value that it adds. And, similar to what people say about technology or internet, like these things are no longer a luxury. They are a needed, a necessity, like, food and water and shelter. If you want to be able to function effectively in today's world and society, you need to be able to have access to these tools, especially when you don't have when you don't lack resources. You may not see these as a luxury. You just see this as, oh, this is something I use all the time. And you take it for granted that other people don't have access to these same tools. And you don't think about what things you might lack if you didn't have access to it. So I just think that this is a great tool to empower people, and just one more thing that people need and are going to continue to need as we go into the future.
Yeah, absolutely. And I will say last week in the group that I led, there was some conversation about how broadband and internet should really be considered a utility, right? At this point, like one of your like water or electricity or whatever like that, because I think it's really difficult in today's landscape. Everything is online. I mean, so you almost need internet connectivity to be an active participant in society at this point. So, yeah, definitely, you're right. I think for those of us that have access, it's really easy to kind of just see it as, oh yeah, we have it and it's important and things like that. But it should not be viewed as a luxury. I definitely agree with you on that. It's really, and again, I think in this context, it makes it so much clearer, right? When people think about internet use, I think they're often thinking about frivolous things like oh, you're going to watch videos or use social media or things like that. But I think this, like the telehealth or the digital health context, I think really amplifies that message of like, this is vital. Like, internet connection is really a vital component. And here's how it can affect health. And I think that could be a really important use case almost, right? To make that argument of like, here's the most important use possible of internet. And here's an example of why it's absolutely vital and should be considered, a utility that everyone needs to have access to, for sure. Yeah. Other thoughts?
I would just say, kind of like we discussed, just making people feel empowered with their own healthcare and like decisions. And I think that them seeing that telehealth can allow that type of empowerment and just being able to know more about what's going on, I think is a
Mhm.
very good way to frame it, to help with the buy-in, because that's the biggest thing is everyone's scared. No one, they don't really know the benefits. So framing it that way, I think is a good way to help encourage people to want to, sign up for the patient portals and actually use it.
Yeah, absolutely. And we touched on that throughout, I think, right? Where the framing is really important. These are tools that can really help you take charge and be empowered to take care of your own health. And again, I think some of that hesitation does go away with the great work that you all are doing with just educating, right, patients, walking them through these concepts, explaining it to them. And I think once they're kind of already entrenched in it, it doesn't seem so scary or big anymore, right? Once you kind of already know, oh yeah, I know what this does. It's not like foreign or scary anymore. But of course, we have you all to thank for that and the great work that you're doing across the state for sure. So hopefully, I think North Carolina is definitely moving in the right direction with regards to telehealth and digital skills education for sure. Well, we are coming up on time. So I will share this. This is the knowledge check for this week. It's 3 questions, really simple. Again, we are keeping track of these. These are what we're tracking in order to give out those certificates of completion at the end of the workshops. So we're just going to track participation in these knowledge checks. So I'll share that. I'm going to hang out here in case anyone has anything they want to talk about or discuss. But thank you so much for the great discussion. We were really hoping that these sessions would be interactive and it wouldn't just be like us talking and you guys just, sitting there and listening to somebody yap the whole time. So I really appreciate your participation. And if there's nothing else to talk about, then I will see you next week for week 4. Thank you all so much for joining us today.
Thank you.
Mira, I had a quick question. Next
Yeah.
week for June, I'll have to be at the 10 o'clock meetings. Do I need to just like email you that, or will the knowledge check be enough? Like you'll see that I'm
Yeah.
okay.
So the knowledge check should be enough because that's again how we're kind of tracking participation. We had like wanted people to join one session or the other, but I think honestly it's all right to hop between whatever session works for you since we are tracking participation through the knowledge check. So yeah, no worries. If one week you need to pop into the 10 o'clock versus the 12, that's totally fine. No worries there.
Okay, awesome. Thank you.
Thanks.
And Mira, all of us at CDE were at a conference last week. So we missed last
Yes.
week's session. So is there a makeup? Is there something you need us to do?
Yeah. So I'm working on this right now. Here, let me just, I'm gonna stop the recording real quick.